Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome back to the Gastro Girl podcast, the go-to resource for everything related to digestive health. I'm your host, Jacqueline Gaulin, and today we're diving into a topic that affects so many of us, living well with Irritable Bowel Syndrome, otherwise known as IBS. We know how challenging it can be to manage the symptoms of IBS, but there is hope. And our special guest today is Jessie Wong, who is an expert IBS and FODMAP dietitian. Now, Jessie has helped countless individuals find relief through practical diet and lifestyle interventions that are tailored to their unique needs. We'll explore some of the strategies surrounding the low FODMAP diet, and she offers some really helpful tips on what you need to know about food and its relationship to your IBS symptoms. Do you have questions about your digestive health? The Ask Gastro Girl app has the answers. Evidence-based, trusted, and powered by AI to support you anywhere, anytime. Track your health, set personalized goals, get tailored nutrition plans, and explore delicious, gut-friendly recipes all in one place. Plus, you can enjoy a free 3-day trial. Download Ask Gastro Girl today from the App Store or Google Play and take charge of your health journey. Thank you so much for joining us today. Welcome.
Well, thank you so much for having me.
You know, we met, last year, and it seems like I've been waiting so patiently to have you on the show, and I'm so grateful that you're here. So let's just jump right into it. And for our listeners who may not know what IBS is, just to kind of give some context, can you start by explaining, Jessie, what IBS is, Irritable Bowel Syndrome, and why it can be so challenging for patients or for people to manage daily?
Yeah, absolutely. So, irritable bowel syndrome is a functional gut disorder. It impacts the gut brain connection, leading to a mix of symptoms like abdominal pain, bloating, constipation, diarrhea, or both. And it is very challenging to manage because everybody have different triggers and it's unpredictable. So symptoms are unpredictable, which makes it hard to live a normal life when people are struggling with IBS. And people are often frustrated because of how chronic the condition is. And there's really no one size fits all approach because you see constipation, diarrhea, and some people have both. Like you can't treat all of them with one size fits all treatment.
Now, I'm so glad you said that no one size fits all. And we've done a number of episodes that dive into IBS, IBS-C, and what we've heard, and you've heard this, and you say this all the time on all of your wonderful content. You have a great Instagram channel, your website, and you've really helped a lot of patients. But food doesn't cause IBS. It can trigger symptoms like patients say, oh, food is causing this. That's not exactly accurate, right? It's triggers. Can you explain a little bit the role of diet in managing our IBS symptoms and how those foods could be triggering and impacting IBS?
Right. So diet actually, while it doesn't cause IBS, it can directly impact IBS symptoms, particularly the ones that are more fermentable. They can cause symptoms like gas, bloating, discomfort if they are rapidly fermented in the gut. But the key strategy, right, is not to cut out every food. It's really to identify your personal trigger foods and balance your fiber intake. And then also work on the foundation of somebody's diets, like hydration, eating 3 meals per day, eat slowly, chew your food. Like these are things that can all help improve your IBS symptoms. But then the food that really triggers symptoms are the ones, most of the time, are the ones that rapidly fermented in the guts that cause a lot of air, gas, and those gas bubbles can cause symptoms and can cause pain.
So can you expand on that a little more? Like what types of foods? And again, there's no one size fits all. So what Jessie mentions here, we're not telling you to go out and stop eating them, right?
Right, exactly. I think that's the main point, right? It's really and what I'm getting into, I guess it will be the low FODMAP diet, really, because FODMAPs are fermentable carbohydrates. Let's just keep it short, just call it acronyms. They are fermentable carbohydrates that our body don't break down. And when our body don't break it down, our gut microbes break it down. And then all of them are rapidly fermentable. So when they get to your colon, they will be producing a lot of gas. They will be, causing your colon to expand, causing air bubbles to be in there. And a lot of people have trapped gas, and those cause a lot of pain. Okay, so which is why the low FODMAP diet works for IBS patients. About, I would say, I think research varies in here. I think 60 to 80% is the numbers that we are hearing. It's like low FODMAP diet helps manage symptom or helps improve global IBS symptoms. When they get to the large intestine, they cause a lot of gas, right? Some of the FODMAPs, this is the tricky part, they also draw fluid into our intestines. So especially the ones that are osmotic, so they're like the sorbitols, the mannitols, the fructose, the lactose. When we eat them and they go past our stomach, get into our small intestine, they start drawing fluids into our small intestine. And that is when you hear patients say, I have a lot of gurgling in my gut. I can hear things swooshing around. What is going on? What is wrong with my gut? And that can be very scary if they don't know food is triggering those symptoms.
That's such great insight, Jessie. And I'm going to ask you the $1,000,000 question. If I was a patient and I came to see you and I'm like, I heard about these FODMAPs and low FODMAPs. I'm so confused. What do I do? How do I start? How would you tell me as a patient?
Yes, and I'm so glad you asked this question because it is so confusing and there is a lot of misinformation about the low FODMAP diets on the internet. And the biggest one being patients think that they have to stay on it forever. And that is never true. And our FODMAP tolerance level can change over time as we improve our gut function. It can actually change. We can eat more FODMAPs. And what we usually explain to patients is that, hey, this diet can help manage your symptoms, but let's take a look at what you're eating first and see, how much FODMAPs you are consuming. So I think because FODMAPs includes a lot of food, right? We are talking about garlic, onion, wheat. These are the obvious ones, but we're also talking about avocado, apples, a certain amount of strawberries, a certain amount of blueberries. We are not going to have you cut everything out because it can be really restrictive. And a lot of the times, patients would leave a physician's office, or maybe they find a list online that says, here's the yes list, here's the no list, and you need to eat like this. It's very frustrating. And patients tend to just look at the things they cannot eat. So it's like, what am I going to eat? So I think the better approach is really to give patients a yes handout. It's like, hey, this is a grocery list that lists all the foods that you can eat on the low FODMAP diet and go shopping according to this. So we are not putting more restriction on, I would say, a population that is already very vulnerable to having eating disorders or disordered eating behavior. So we are really helping them say, look at all the foods here. You can eat them up to a certain quantity and they are listed. And then what I usually tell patients is that go highlight the foods, go shop accordingly. And then they are staying on a low FODMAP diet, focusing on what they can eat instead of thinking how frustrating this is. I can't eat anything. And then they stay on it so we usually tell patients, hey, this diet is for about 2 to 6 weeks. We'll keep monitoring your symptoms during this time and hopefully get you to baseline sooner rather than later. And I think it's also really important for patients to work with a specialist, like a trained dietitian who understand the nuances of this diet and can look at somebody's diet like, okay, maybe, this meal is a little bit higher in this food here, so you are having a bit more symptoms. But it is okay. Let's just go back to low FODMAP and you are still at baseline, everything is all right. Giving patients the reassurance that I am doing the right thing. I'm okay. Yes, I might have symptoms a little bit because I had a high FODMAP meal, but it's all right. It will pass, and then we can challenge the FODMAPs. So the first step is the elimination of the low FODMAP phase, right? And then we move on to the next step, which is reintroducing, or we like to call it challenging FODMAPs group by group to see what you tolerate, what you don't tolerate, and what your level of tolerance is. And I think this is another mistake that we see patients make when they are trialing the diet on their own. Oftentimes we hear the all or nothing approach. I'm going to eat no FODMAPs at all. And then when they can't do the restrictive diet anymore, they're like, forget it. I'm just going to eat everything again. Now, the diet is not meant to be done in that fashion. We really want to challenge each group and subgroups of the FODMAPs one by one. And what we do is we challenge the food over 3 days. We start with a very small amount. And then on the first day, and then the second day, we do a moderate serving. And on the third day, it will be a full serving of those food. So for example, I'm thinking garlic and onion, right?
Yeah.
That's what everybody
Yes,
misses the
yes,
most.
yes.
So for example, with garlic, we are starting out with like 1/4 garlic on day 1, and then half a garlic on day 2, and then 1 whole clove of garlic on day 3. And surprisingly, most people will be able to tolerate the garlic when they actually challenge it and understand their tolerance level. And then our patients will tell them, go keep eating the garlics. It contains a FODMAP called fructans, and fructans are really good for our gut. We know that is one of the fiber that feeds the good gut microbes that we want to feed, right? It feeds the lactobacillus, the bacillium kind of microbes, and we want to eat more fructan, but maybe not too much that you can't tolerate. That causes symptoms in your gut. So that's one challenge. And then let's talk about onion. Onion is kind of interesting the way Monash puts it. So Monash University, of course, they are the researcher and the creator of the diet. But with challenging onion, it is 1/8 onion on day 1, 1/4 on day 2, and then half an onion on day 3. And then our patients usually look at it, Jessie, I'm not going to eat half an onion in one day. How am I going to do this? I was like, you can do this. You can split it up over 2 to 3 meals. It's okay. And let's just see how you do. Then you have a better understanding. And guess what? A lot of our patients can tolerate that amount. And then they can go out into the world and not worried about FODMAPs or at least fructans anymore. And that's always the goal, right? Is to improve somebody's confidence into knowing what they can eat and what they may not be able to eat. Now, half an onion is a lot. So let's just be honest. Not
Especially,
everybody can.
yeah, some of those onions at the grocery store, like,
Right. Right. There are specific grams, like in grams that we tell people to eat. So it's not like that ginormous or maybe the Walla Walla onions, right? They're really big. So it's not going to be that much. But anyways, some people may just tolerate day 1 or day two's amounts, right? So 1/8 and 1/4 onion that they can tolerate, and they can't tolerate day 3. Half an onion is a lot for some people. And that is okay, because if they can tolerate the smaller amounts, our recommendation would be keep eating that smaller amount. Again, onion contains the FODMAP called fructan. It feeds our good gut microbes. And then when our gut microbes are well fed, more likely than not, you'll be able to tolerate more fructans down the road. So with FODMAPs, I think one of the things we really try to tell our patients is that your tolerance to FODMAPs can change over time, especially when you are taking care of your gut, when you're having regular bowel movements, when you understand and improve on your lifestyle triggers, then your gut function will improve. And when you're eating more food and more variety of food, your gut function will improve as well. So the key, I think, too, is to tell patients, hey, this is not a long-term elimination diet. It's very short-term, and you need to eat more food to keep your gut healthy.
Jessie, I just love your compassion and the way you explain this I would love to be your patient, because it's very challenging to find someone that can listen to the patient and break information down in a way that's understandable. Now, we're not trying to give people a how-to directions on do this in this episode. What I'm trying to showcase is your knowledge and compassion, and provide hope to patients who may be listening that struggle with these symptoms, that maybe their doctor handed them a sheet, like you said, which happens all the time. We've had doctors ask us, do you have a low FODMAP sheet? When I first started Gastro Girl, I'm like, no, we're not going to give you something like that. It's irresponsible for the patient. But they didn't know at that time either. So I want to call out the fact that there are nuances, and that it's not about listening to an influencer on social media who tells you to do this diet that knows nothing about the diet. It's not really a diet per se. It's a way of figuring out what foods trigger you, so that you can identify them and not be so avoidant and restrictive with your eating, because that's a whole other uh, rabbit hole that patients can go down that can be very detrimental to their health. So I want to stress the importance of working with a GI expert, registered dietitian such as yourself. And that's why we're showcasing you today, because it's such there's so many foods, like this is low FODMAP, that's low FODMAP. It is overwhelming and frustrating. And I hear all the time from patients who are so sad, they're struggling, they want to give up hope, but it doesn't have to be that way, because there are experts such as yourself. And there's even a gentle form of this approach, isn't there? Explain that, because I think
Mhm.
this is even more enlightening. I love this.
Yes. So with the gentle FODMAP approach, we are only removing certain groups of FODMAPs, but then we're still removing most of the fructans and then some of the GOS. So the beans, the garlic, onion, and wheat, and then some of the polio. So we're not removing everything. And I will have to say, nowadays, when our patients come in to us, we look at what they're eating, and we may tell them to remove certain things from their diets without telling them, hey, you are doing a modified or gentle form of the low FODMAP diet instead of doing the full FODMAP diet. Just say, let's watch and let's see how things go. If things don't improve, right, we may do the full elimination, but most of the times, people's symptoms will improve already by removing certain groups. So not all of the FODMAPs, which makes life a lot easier for patients.
Yeah, and for those, I'm not trying to, say you don't have to work with a dietitian for the rest of your life, but not everyone can afford that type of help. But for a short time, like just trying to identify and maybe check in every few months, it makes sense than trying to go through on Google and on the social media to try to figure out what they're supposed to eat, right?
Right. So normally, so the way we run it is we do a short term program, 3 months, eliminate, reintroduce, and then personalize at the end and creating that long term plan. So it's never like a long term thing that you have to check in with a dietitian. But one of the things that our patients tell us, because a lot of our patients struggles with diarrhea, some of them have really bad constipation, but the diarrhea ones really say, well, if anything goes wrong again, I know where I can find you. Like that's reassurance, but most of the work is done for that initial 3 to 4 months when we're working together, really get you to challenge every single food.
Yeah, and the reason why I wanted to bring that up is because we have some patients, oh, I can't afford it. I can't afford it. But then again, they're buying all these products and trying all these things, and they're in worse shape than they were. So it's an investment in
Yes.
your health that may initially be somewhat of an expense, but it's so beneficial because you kind of have direction, and you're not alone. Like there's guidance, there's expert, the a number, and we're so grateful to the programs that have educated dietitians such as yourself in GI and gut health. When I first started in this space, there were hardly any GI dietitians that were doing this,
No.
and especially with the low FODMAP diet. So
Yeah.
this is huge.
I'm so glad you brought this up because when we started out on the low FODMAP diet, so I'm a second career dietitian. I used to be an accountant, but then when I was going through school to become a dietitian, so my husband struggled a ton with IBS. He got a diagnosis when he was in grad school doing his PhD. But there wasn't any suggestion was given to him. It's like, well, you have IBS. That's just gonna how it will be. So every time he would go to the doctor, that's kind of the same response he keeps getting. But then I pushed him. It's like, you need to see a GI. You need to see somebody who knows this. And he got scoped. Thankfully, everything is okay because there can be worse diagnosis than IBS. IBS is debilitating, but it's not life threatening. And as I was going through school to become a dietitian, my professor said, hey, do you know the low FODMAP diet? And at that time, I was like, no, I don't know the low FODMAP diet. And I went to research all about it. And I downloaded this handout from one of the very prominent medical institutions. Their dietitians created it. But that handout basically said this is a long term diet. Here are the foods that you need to eliminate. And we just put it on our fridge and we became low FODMAP. I think for years, actually, because that's what we thought. Like you said, there were no education material for patients. There were a lot of publications, but there's nothing really like teaching us how to do it successfully. And we were on low FODMAP for a few years, and after a few years, that's when it really hit my gut. I didn't have IBS. I didn't have any issue. And of course, pregnancy as well. So it's pregnancy induced IBS, but I was very, very constipated. And that constipation didn't resolve after pregnancy. And when I went to our family physicians and I said, now I'm having all the symptoms like my husband. And he just chuckled at me. And I was like, I bet he gave me something. Can we run? Right? It's like you're just thinking about all
Yeah.
the bad things that can happen. It's like, can we run all the tests? And of course, everything came back normal. It's like IBS, IBS-C. Okay, go learn to manage it. And like you said, I'm really thankful that Monash came up with the training for dietitians. It's such a complicated diet. Now was looking at it the other day. It was like the training for dietitian, intense training, 16 hours to learn all of it. Well, not all of it, because you really have to learn more of it when you are practicing. When you learn the theory, that's one thing, right? When you're practicing, you're really learning how to implement it and how to communicate with your patients about how this diet is done and what we are doing. Here are all the steps. And once I did that training, we reintroduced all the food. We didn't have any food triggers. My husband had a little bit, but it wasn't crazy, right? And we were able to add all the foods back into our diets. And guess what? My constipation is way better managed nowadays, now that we're eating way more
I
food.
bet you were probably so restricting. And this is a great
Mm-hmm.
testimonial to the hazards of trying to implement this by a piece of paper because everyone's different. You and your husband have different guts, like everyone, we're all different. And you probably were restricting so much food that your body was like missing things, probably a lot of fiber and other things that would regulate your system to, some normalcy.
Yes.
You poor thing.
Yes.
Yeah.
Yes, I really do think that's what happened and probably shifted my gut microbiome as well when I was eating, a very limited diet. I mean, we were still trying to add more varieties into it of what we can, but it's still not like what you can normally eat without a low FODMAP diet. So really, to anybody listening, it is possible to add the food back, but you got to work on the foundation of your gut, improve your gut health first, and then slowly reintroduce one food, one group of FODMAP at a time, and not try to overwhelm your system by adding a bunch of food back all at one time, because one, you wouldn't be able to identify what may be causing the symptoms. And if you haven't eaten FODMAPs for a long time, that can be a real shocker for your system and can cause more symptoms. So it's a really step-by-step approach when it comes to reintroducing food.
Oh, thank you for that great insight. I want to talk a little bit beyond FODMAPs and, what a lot of people are seeing more and more. There are, and you probably see this all the time in your practice, there are countless amounts of food and food products and drinks with all sorts of stuff. Now, add this to trigger foods, and you have a perfect storm of absolute uncomfortability, I would think. Can you talk a little bit about that? Like, what else can other dietary interventions, like people are drinking those sodas with prebiotics,
Oh,
probiotics, enzymes, there's gummies, there's cookies, there's
oh my
ice cream,
goodness.
there's even skincare products with probiotics in them. Can
Yes.
you give us some insight on this and kind of level set us and what we should be thinking about to
Yeah.
make better choices for our gut?
I'm so glad you bring this up because it's a trend, right? I think the trend in the food space is moving toward gut health. And what manufacturer think of gut health is we need to add this in, we need to add that in, we need to have all of the catchphrases like it's got prebiotics, it's got probiotics, it's got added fiber, it's got a whole host of things in the product. And people look at them and think that, oh, this must be good for me. Mm-mm, mm-mm. You got to be careful. I would say really, really have to be careful with the added fiber and also the probiotics. Added fibers, a lot of the times, they add high FODMAP fibers into the food. There is one of those bubbly drinks that to really try to promote to dietitians and to everybody that have like 9 grams of fiber per can. And we look at it and think, wow, that's like 1/3 of your fiber need in a day in a tiny little can. How is anybody's body going to handle it? And a lot of the times they are high FODMAP fiber. I think they've changed their formulary, but they don't specifically tell you which are the high FODMAP fiber, which are the low FODMAP fibers in there. So for anybody with gut disorders, with IBS especially, if you are sensitive to FODMAPs, you want to stay away from those drinks. Bubbly drinks sometimes can cause us to swallow more air, but bubbly drinks with fiber and probiotics, stay away from them. If you have to drink something bubbly, right? Drink the La Croix.
Oh
I
yeah,
don't
the
know if I'm saying
seltzer water.
the salsa water. Drink something that's slightly flavored and it's got bubbles in it. Yes, it may still cause a little bit of discomfort, but it will go away pretty quickly as you pass the gas or if you burp things up. Now, probiotics. Oh my goodness. Probiotics is strain specific. You have to match the right strain with the right condition to get any benefit out of it. And probiotics, the thing about probiotics is that we just don't have long-term safety data to suggest that taking any of the strains long-term can actually be beneficial for your gut. We know that per research, it does not shift our gut microbiome, which is a good thing, right? Because can you imagine taking something for short term and it actually changes your gut microbiome? And we don't know whether it is a shift to the better or to the worse because we just don't know. We probably have very different gut microbiome and we can still call them healthy gut microbiome. So probiotics, you have to match the right strain. When you are taking the wrong strain, which is what we see a lot as well, people can start having more gut symptoms. Most of the time, it is nonstop diarrhea. Some other times, we've seen people getting intestinal methanogen overgrowth from taking random supplements, probiotics, prebiotic fiber, that they are not sure that they walk into a health food store and the salesperson there say, hey, this is better for your gut. Like the salesperson, they're trained to sell you products. They're not really trained to understand the science behind the products. And most of the products on the market are not evidence-based. And we are seeing long-term damage in some cases. Well, they're so desperate that they start coming to us, right? And we're seeing these long-term damage. So one of my patients a long time ago, it's a he. We worked mainly with female, but this is a he, and you can see how desperate he must have been. And he was someone who was having a lot of diarrhea nonstop. He would eat something and he would be pooping it out in 20, 30 minutes. Then the food would come out and he can see the food. That's how bad it is. His PCP actually referred him to work with me. And this is somebody in the wellness space. So he teaches yoga. So he's in the wellness space. So he's like, no, I don't want to do any elimination diets. I want to go find somebody in the functional space to help me. And he went to actually a functional doctor that is very prominent in their area instead of coming to me. And what he did was the doctor did a lot of tests. And these are not legitimate tests. They did the food sensitivity test, they did gut microbiome test, they did a lot of nutrient deficiency tests. And they found that he was deficient in a lot of things and also put him on a ton of supplements, as we can probably imagine. And the poor guy, he was even giving himself B12 shots every week. Now, he was having a lot of diarrhea. I would not, be surprised that he's B12 deficient, but they were not really looking at what is causing the diarrhea, but they're doing all these tests and tell him to remove all the foods that he could actually
Oh
eat.
wow.
So, the food sensitivity test, we hear it all the time in our space. This is a test that sounds very sciencey. They measure IgG, but IgG is not a marker of food intolerance. As far as what we know and what research thinks right now, it is a marker of tolerance. So if you are listening to this podcast, if you've done the food intolerance test in the past, throw it out. Don't be afraid of it. When he finally came back to work with us, he just showed me that and said to me, Jessie, I don't know what I can eat. This test told me everything I eat, I'm intolerant too. So I have no idea what I can eat. And I told him, just toss it away. That test is not relevant. It's not accurate. I'm sorry you wasted your money on there. And when we did a really deep dive on what was going on, he is a complex case because he has diarrhea. And when we did a medical assessment, we realized he probably has SIBO. So I actually sent him back to his PCP and say, let's get him tested for SIBO. Let's, get him treated for SIBO, small intestine bacteria overgrowth. And once we treated him for SIBO, his diarrhea slowed down significantly. Now, we also put him on the low FODMAP diet because he was running to the bathroom multiple times a day. Low FODMAP diet works very well for diarrhea patients. It can really help manage the diarrhea. So after he was on low FODMAP and also taking the antibiotics to get his SIBO treated, he was a lot better.
Oh, no.
Oh, one more thing. He was taking a probiotics supplement that he was drinking. So it was a drink that his colleagues recommended to him. And I really suspected at that time that was the culprit. So once we got his SIBO treated, we got him through the low FODMAP challenge phase, he tolerated everything. Like he was fine. His big problem was the SIBO. And guess what caused the SIBO?
Drinking that.
The probiotics drink. Yeah. So I asked him, did you used to have constipation? Did you used to have bloating? And he thought about it. And then the next session, he told me, Jessie, you asked me if I was constipated before. I think in hindsight, I was. And I was bloated, most likely because of the constipation. And I was irritated. He was irritated by the bloating. So he wanted to try out different things to resolve the bloating. And that probiotics drink was what probably helped initially to help him fully evacuate. But as he kept drinking it, he started having SIBO, small intestine bacteria overgrowth. And I can't tell you how many cases like this we see in our clinic, just people taking random supplements, giving themselves.
They're self-diagnosing or listening to an influencer, but then they're doubling up. They're drinking the soda, they're drinking the yogurt, they're taking whatever capsules. And then there's all these
Yes.
like formulas now where you can make a smoothie. It's overload. I mean, I think those things have a place for medically necessary where it shows evidence. But for
Yes.
people just going and randomly picking up stuff and then duplicating it multiple times, I'm sure you're seeing an increase in your practice of people that are like that gentleman who has to reverse all the things and figure out that he's really not triggered by food. It was what he destroyed his gut, and now he has to build back those healthy microbes that can digest things better.
Yes, exactly. That actually doesn't make him run to the bathroom. And we actually see this a lot. And sometimes, people might be on multiple rounds of antibiotics to try to treat their SIBO. And then when they're taking the antibiotics, their bowel movements are normal. But when they stop the antibiotics, the diarrhea comes back. And then we will be looking at what are you doing different? What is going on? And then again, we looked at what they are doing is, well, you're taking a probiotics here. This is probably what is contributing to your upper GI bloating, to your diarrhea symptoms. So yeah, caution to everyone. And it's so prevalent. It's in toothpaste, it's in protein powder, it's in every single thing.
Yeah, I mean, I'm glad you talked about this. We could talk about this over and over again.
Yeah.
But so let's talk a little bit about, what I love about what you do is you look at the whole person. You don't just, you take in consideration their lifestyle factors in addition to diet. Now we have so many great new bodies of evidence that show the, the relationship between the gut-brain axis and how things like stress and lifestyle choices can impact our symptoms when you have IBS. Now, we're not saying that it's in your head at all, but there are legitimate evidence-based gut-brain component to this. So can you talk a little bit about when you're working with patients, in addition to diet, what other lifestyle changes or lifestyle factors do you ask about, and how do you incorporate that in a personalized treatment plan?
Yeah, absolutely. So, and when we're working with patients, we really emphasize stress management that can really help improve the gut function and also symptom severity. And we would encourage patients to do gentle exercises like yoga, walking, and then practicing mindfulness, meditation. And then sometimes, of course, if we see a patient who is very anxious, they might need more cognitive behavioral therapy. We would refer out to GI Psych to say, hey, this patient, we can work together with them so that you can help them create better routines or help them create tools that can manage their stress or their anxiety level a little bit better. Because we know, right, it's really like a vicious cycle of being stressed, eating food that may cause more stress, and then the food causing symptoms, and then It's an endless cycle. You will have to break it somewhere. And then if normal things that we do, like yoga, meditation, walking, or deep diaphragmatic breathing doesn't help, sometimes it is best to seek help from a trained professional, like a GI psychologist.
I'm wondering how many patients who have IBS and, have to worry about the food triggers, how much of that is anxiety inducing for them? Do you see
Oh,
that? Just worried about food and eating, like,
I think by the time they come to us, all of them are very
yeah.
anxious. I mean, but then some, of course, are more anxious than others. It's really tricky sometimes. And sometimes we see patients who's reluctant to reintroduce food. And these are the ones that we really
Oh,
need more intervention. Most of the time, our patients would be really excited to reintroduce food. Yes, they are nervous, right? But they are excited to see their tolerance level to really understand, do I tolerate this? How much of it do I tolerate? But then sometimes we need more intervention. And let's go back to the lifestyle factors. One of the
yes,
things
yes,
that
yes.
people have a lot of question on is exercise. Now, when it comes to exercise, right, we do encourage people to do exercise if they can every day, if not 4 to 5 days out of a week. But for those of us with gut disorders, we probably want to choose something that is more moderate level, moderate intensity exercise that helps with gut motility, that helps us breathe a little bit deeper. Because when we're breathing a bit deeper, right, it's stimulating our vagus nerve. So it helps with so many things in our body to calm our body down. And in terms, it calms our guts down. But nowadays, a lot of the questions we get is it okay for me to do high intensity workout when I have IBS symptoms? And I usually recommend people not to. If your gut is telling you it's not feeling well and you are pushing yourself through, like, how the influencers would say, if you're not exercising hard enough, or if you're not, what is that term? No pain, no gain? It's like,
Yeah.
no. Well, if your body is telling you to rest, you need to take that as a signal and maybe dial it back a little bit. And when people are exercising, one of the main things, if you're listening to this podcast, one of the main things you need to understand about exercise is we tend to sweat when we are exercising. You need to be well hydrated going into the exercise. You need to stay hydrated during the exercise, and you need to replenish after the exercise, especially for people who are doing high intensity workouts. If you are dehydrated going into the exercise, it will cause more gut symptoms. It will cause more inflammation in your body. And one of the things about high intensity workout is that it draws fluids, it draws blood fluids away from our GI tract. And we know that the reduced blood flow can cause more inflammation in the GI tract. So if you are dehydrated to begin with, there will be decreased blood flow to your gut. So you have to be well hydrated going into it and replenish accordingly. And then before exercise, eat simple carbs. Eat low FODMAP simple carbs like potatoes, like rice. Rice cakes is a good option. Easy to digest so you don't have residue in your stomach, because that is another thing, right? When we're exercising, if there's a ton of food in your stomach, it can cause a lot of discomfort. So eating low FODMAP prior to exercising can help too. But the best is listen to your body, know where your limit is. If your body is telling you to rest, rest, or do something more gentle.
I love this advice, Jesse. Talk a little bit about, some of us chug a lug the Gatorade, all these protein drinks that have either high FODMAP content or sugars that bother us. They're doing the goo if they're doing long distance running, and they're having possibly, or the bars that have artificial sweeteners that
Oh, yes.
impact our symptoms as well. Can you just talk a little bit about that? Just some like tips for
Yes.
patients.
Yeah, so artificial sweeteners, like anything ends with a TOL or something OL, they can cause more gut symptoms, just like mannitol, sorbitol, some or xylitol. They can cause gut symptoms, and a lot of the sports snacks and foods, they do contain a lot of sugar alcohols or sugar sweeteners. So avoid those if you can. I usually recommend patients to get something that is made with simple syrup, maple syrup, or just sugar. That's easier to digest. It doesn't cause more gut symptoms. And like we talked about earlier, these sugar alcohols, they can draw fluids into your intestines. It's like they have the osmotic function. So when you eat them, they get into your small intestine, they would be actively drawing fluids into your small intestine, and it can cause a lot of gurgling and churning in the small intestine. So make sure you're getting something that is easy to digest. Rice cakes is one of my favorite go-tos. Like put a thin layer of peanut butter on it. It's a perfect low FODMAP snacks for you. Maybe eat it 30 minutes before your exercise or before running a long distance. I mean, but if you have gut symptoms, you might want to avoid it. Oh, and this brings me to another point. If you ever see blood, because runners diarrhea, right? If you ever see blood when you're running long distances, please go see a gastroenterologist. Please talk to them about, what may be going on. That's something we actually hear sometimes as well, mostly from friends and families that are running, or they have friends and families that are running and they have blood or they have GI issues or they have diarrhea. So make sure you are drinking enough fluids. That can help reduce the risk of having gut symptoms when you're running and then eating things that are easier to digest before exercise.
Jessie, I could talk to you all day. We're going to have you back on again, but I really want to focus on some of the things that you're doing for
Mhm.
resources and support for patients. I'm really impressed. I've been in this space a long time, and you're extremely knowledgeable. You're not very knowledgeable about this space. Talk a little bit about some of the resources that you like, including your own, that are helpful and that are out there for patients.
Right. Actually, one of the things we provide for all of our patients, and it's a free resource on one of our websites, prepedia.org/resources, is a symptom tracker. I think it's really important for patients to understand what is going on with their body because oftentimes they come in and say they're bloated. They don't know where they're bloated. They don't know how long the bloats last. They don't know what type of bloating it is, or if they have pains. Like we want to know if it's sharp pain, dull pain, or is it a stabbing pain. These are things that a patient should ideally understand about their body before they go in to see a provider, whether it is a dietitian, whether it's your PCP or GI. Learn more about your body. So we have a symptom tracker for patients to track what you're eating, what your symptoms are, where do they occur, how long does it last, how often does it happen, and then on the symptom tracker, I'm really proud of it because, as women, we tend to get more IBS symptoms and it can fluctuate throughout our menstruation cycle. So on our tracker, we have the menstruation, like what day are you in your menstruation cycle? And also how much fluids are you drinking and how much sleep are you getting? Because these are all factors that can affect our GI tract. And if we overlook those things, it's never really gonna help you get better, improve your gut symptoms. And when we're only focusing on food, that's what I'm trying to say. And a lot of patients, they are really just focusing on food. They're not looking at the bigger
The whole
picture.
picture.
So I love that symptom tracker. It's great for patients to try it, track everything for 1 week and see, where things are. And a lot of the times we will say, well, when I'm not sleeping enough, I tend to have more this type of symptoms. Or when I'm not having a good bowel movement, I'm more bloated toward the end of the day. Like we know that constipation is the biggest reason why somebody is bloated, but most of the time people don't know that. So tracking your symptoms, learn more about your body. Before you try any elimination diets, don't cut out food just yet. When it comes to the low FODMAP diet, we also have a free resource. Of course, there is the Monash app, right? It's the best, it's the most up to date because they do all the testing. But we also have a free resource for patients, and that is on ibsdietitian.com/resources. We have a low FODMAP starter kit that can help patients get started correctly. And like I told you earlier, we have a grocery list. So if you are recommended the low FODMAP diet and you're looking at the list of things that you cannot eat, now go get yourself a list of things that you can actually eat. Highlight the food that you like, go shop accordingly. Don't think about the restriction. Think about all the things you can still eat.
That's great, Jessie. And lastly, do you have any words of encouragement for those who may be feeling frustrated or overwhelmed by IBS?
Yeah, I would say IBS is a chronic condition, right? So managing IBS is a journey and there will be setbacks and it's a normal part of process. So if you're actively trying to manage your IBS, you will see some good days, you may see some bad days, but the more you understand about your body and knowing how to prevent symptoms or manage your symptoms, then you will have more good days moving forward. The key is really to understand your body. And you are not alone out there. I think one of the things about IBS is people feel really alone and people don't talk about poop symptoms or food symptoms, when they have symptoms or if they've shared it enough, then their friends and family start to tune out. And sometimes they might even feel like every time they share, they are gaslighted by the people, that love them and they love. But really, you are not alone. There are many communities out there that offers. I wouldn't want to say offers supports, but offers the community for IBS patients. I'm in a few Facebook communities, but I would say I think those communities are good for you to not feel alone, but be careful of the advice you hear on those communities
Yeah.
because what I'm seeing a lot is people promoting supplements
Yeah.
and promoting more restrictive diets. Yeah.
And then it gets negative. We don't need more negativity. We want to uplift patients. I love that you say what you can eat, and great advice, Jessie. I look forward to having you on again for sure. This has been so enlightening. I hope I'm sure our listeners will find this extremely helpful. Thank you so much. And I look forward to talking to you again.
Well, thank you, Jackie. It's such an honor to be here.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.